Hi, Phil Borders, Hendricks Therapy. Today we're going to answer the question, will I become addicted to my medication? So let's first look at the definition of addiction. The best definition that I've seen is when you define addiction as a chemically driven behavior. So let's look at chemically driven. If you take a group of people and you give them a certain substance, be it cocaine, be it heroin, a certain percentage of those people, their brains are going to light up. Their brains are going to dump dopamine, which is the pleasure chemical of our brain. Other people, their brains, probably light up, but not as much as some. So there's a group of people, a percentage of the population, through no fault of their own, their brains just light up. Their brains just really, really like substances. And you look at, fancy PET scans, fancy MRI scans, and their brains actually do light up. I mean, it's pretty remarkable when you see it on film. So when people have that type of brain and you've given them a substance, their brain's going to remember that. And it's going to be like, I really miss that feeling and I feel really bad off that feeling. So they become preoccupied with the drug. And that's where the behavioral component of chemically different behavior comes in. Because if you're preoccupied with something, generally speaking, you want to satisfy that preoccupation. So despite the fact that they are ruining their health, despite the fact that they might land in jail, that they might have their kids taken away, they could get divorced, they could lose their job, they still want to use that substance and they still are driven to use that substance. So that's the definition that I like to use of addiction. Now with psych meds, there's two potential classes of psych meds that can cause addiction. One is benzodiazepines. Now those are the medications like Valium, Xanax, Klonopin, Ativan, and then your stimulants like Ritalin or Adderall. Both those classes of medication have the potential to cause addiction. Now, for the vast majority of people who have anxiety, who have insomnia, they don't get hooked on these medications. They don't develop this chemically driven behavior. The medications just help them feel and function better. It helps them sleep better. Now, if somebody comes into my office and they say, I need some Xanny bars, or they do the opposites, like I can't remember the name of the medication, I think it's called Xanax. If somebody's doing that, then I kind of know they're scamming me. And those are people whose brains have probably lit up in the past with these medications, so you try not to feed into that behavior and work with their anxiety in different ways. For stimulants, stimulants can be abused. If you look at people who have ADHD, and you look at the data, people who have ADHD and they're given stimulants actually are less likely to abuse substances, basically because their ADHD is being treated and they're not, doing poorly in life. They're functioning quite well. They're not trying to treat their problems focusing with cocaine, and they generally just do better. So for psych meds, yeah, they can be addicting, but for the populations that they're used for, generally that's pretty rare to happen. Now, you can still have some withdrawal symptoms from psychiatric medications, especially like antidepressants and from benzodiazepines. So you can still have withdrawal symptoms, but that doesn't mean that they're habit forming. You can withdraw from a medication, but as long as it's not a chemically driven behavior, again, the definition of addiction, then the people aren't addicted to it. Hope this was helpful, and I'll talk to you later.